Hello to everybody watching this. In case you don't know who I am, my name is Carissa, and I am 31 years old. And I make videos to try to spread awareness to subjects that don't get addressed very often. Take that off so there's no glare. Today, being that it is Fibromyalgia Awareness Day, seemed like a great day to go ahead and talk to you a little bit about fibromyalgia. And I absolutely challenge you to watch this to the end. I'm not going to make it very long, but there is not enough awareness about this disease, and there are far too many people who think that it's non-existent, and that the people who claim they have it are just lazy and don't want to work, and you couldn't possibly be in that much pain. You couldn't possibly feel that bad. And I'm here as a testament to tell you that I was one of those people. At one point in time, I was one of those people, and then it happened to me. I'm a believer now. And it's hard. It's the hardest thing I've ever done in my entire life. It is a 24-hour a day, 7 days a week, 365 days a year battle. I struggle every single day. And some people will never understand because they never see that struggle. Now, if you have ever been around me in a work setting, or you're a friend of mine, you know, hopefully you know, because you've seen the struggle. And it's just really not fun. So, what is fibromyalgia? It's really hard to explain, but the best way to explain it is it's an inflammation, irritation of our fibers. It messes with your muscles, it messes with your joints, it messes with your nerves. It's a neurological disorder, but it has also been classified into a rheumatoid disease as well. So people are really mixed. People with fibromyalgia, who they go to for treatment is really mixed between a rheumatologist and a neurologist. And then some just kind of skip over both of those and go straight to a pain specialist. But I'm finding more and more fibromyalgia patients. Keep in mind, I have a fibromyalgia group that I run, and we now have 2,300 members. We have people from all over the world, all walks of life, all ages. Fibromyalgia does not discriminate. It is mostly affecting women, but there are men who have it, and I know one of you is probably watching. And I hate that anybody has it. But anyway, fibromyalgia, it's life-altering, it's mind-bending. And like I said, a lot of people actually skip over the pain specialist, and I've been seeing this more and more in my group, because all the pain specialist wants to do is trigger point injections. And while those are temporary relief and they feel great, it's something that it's just ongoing and ongoing and ongoing. And with the hope that you have with going to see a rheumatologist or a neurologist, the hope that you have is that they can put you on a preventative medication that prevents the symptoms from happening across the board. And then you don't have to worry about taking abortive medication. I am one of the unlucky ones who I've tried every preventative medication there is that's used to treat fibromyalgia. And I was the same way with my migraines. Preventative medications have never done anything for me, and I don't know why. I don't know if my body is just like, no, thank you. But it is what it is. And so anyway, I had been asked to make a video like this by a couple people, and I realize that not nearly as many people as I would hope are going to watch this. But for those of you who do, I appreciate you. And so, without further ado, the last thing that I want to do is read to you all of the symptoms that may or may not affect a patient with fibromyalgia. Now, realize when I read these that not everybody has every one of these symptoms, okay? Fibromyalgia is so widespread and so across the board, and the levels of your fibromyalgia will vary. You know, there are some people who are able to work that have fibromyalgia, and then there's people like myself who my pain is so extreme, I would be the most unreliable worker, and that basically at the end of my career, that's how I was, and that's not who I want to be. I want to be dependable, responsible, and reliable. And when you're down with this disease, you know, and like I've told you before, this is my everyday, guys. It's right here, minus the eye crusties, is my everyday. You can truly see that I don't feel well. So, some of the symptoms: delayed reactions to physical exertion or stressful events. Other members with fibromyalgia: sweats, unexplained weight gain or weight loss, craving for chocolate, carbohydrates, headaches and migraines, vision changes, pain that ranges from mild to severe and may move around the body, morning stiffness, muscle twitches, diffuse swelling, fibrocystic, tender, lumpy breasts, allergies, postnasal drip, runny nose, mold and yeast sensitivity, shortness of breath, earaches, itchy ears, ringing ears, thick secretions, light and or broken sleep pattern, fatigue, sleep starts with falling sensations, twitchy muscles at night, teeth grinding, menstrual problems. PMS is an overlapping condition, loss of libido, impotence, bloating and nausea, abdominal cramps, pelvic pain, IBS, urinary frequency, difficulty speaking known words or other language impairments, directional disorientation, poor balance and coordination, paresthesias in the upper limbs, which is tingling and burning sensations, loss of ability to distinguish some shades of colors, short-term memory impairment, confusion, trouble concentrating, staring into space before brain kicks in, inability to recognize familiar surroundings, sensitivity to odors, pressure changes, temperature, humidity, light, noise, night driving difficulty, sensory overload, panic attacks, depression, tendency to cry easy, free-floating anxiety, mood swings, unaccountable irritability, mitral valve prolapse, irregular heartbeat, pain that mimics a heart attack, and costochondritis, pronounced nail ridges, nails that curve under, mottled skin, bruising or scarring easily, hair loss, tissue overgrowth, hemorrhoids, and nosebleeds. And for me, teeth. And that has a lot to do with my lap band too, but I'm finding more and more fibromyalgia patients whose teeth are just absolutely decaying out of their head, and that's me. I take wonderful care and have great hygiene of my teeth, but they're falling out. So what I ask you to do today is please reach out to your friends or family who have fibromyalgia and say to them, I believe you. I believe you, and I am here for you. And I will be here for you. Reach out to your family and friends who have fibromyalgia more often than you do. Ask them, hey, I'm going to the grocery store. Do you need anything? Hey, I'm getting ready to do a bunch of laundry. Do you have any laundry that you weren't able to do this week? Can I help you with supper? Can I bring you by a meal? They may say no, because even myself, I have trouble accepting help. But the thought and the sentiment behind asking is more appreciated than you will ever know. I can't explain it. Okay, and so how I want to end this video, and please don't mind my room mess here because it's been a rough fibro week for me. But because of all the symptoms that I just named, you have to be prepared. You have to be prepared, okay? So, prepare yourself for this. This is what a fibromyalgia's patient's medicine cabinet looks like. You have to be prepared for everything. And I like to think that I'm prepared enough that I could treat people in devastated foreign countries. But I use all of that. At some point, I use all of that. So please educate yourself about fibromyalgia. Ask me questions. I would be happy to answer anything. And please, for the love of God, support your friends and family with fibromyalgia. What they're dealing with is real, okay? It is real. You might not want to believe that somebody could be in that much pain or be dealing with one or any of the symptoms that I just named, but we are. And I could sit here and tell you the worst of my symptoms, but I've already rambled on for 12 minutes. So today, May 12th, is Fibromyalgia Awareness Day. Spread this video around. Spread fibromyalgia memes around. Let's get the word out, folks. We need a cure. There are currently no tests that completely lay out that you have fibromyalgia. Basically, the only thing that doctors are able to do at this point is rule everything else out. And once everything else is ruled out and you show that you have tender pressure points in at least, I think it's 10 out of 17 pressure points, if you are shown to have pain in 10 out of 17 pressure points and you're testing negative for all other diseases that would mimic these symptoms, you're diagnosed with fibromyalgia. And so you can see why people don't believe it, because I don't have any test papers that I can hand you to say, here, she has fibromyalgia. And often we're labeled as drug seekers. Well, you know what? Yeah, I am a drug seeker. And you want to know why I'm a drug seeker? Because I hurt. I am miserable. Okay? That's why I seek drugs. I don't seek drugs because it's fun for me, and no other fibromyalgia patient does either, and so I would just like send out a big thing of gratitude to all the junkies out there who have made my and my fellow fibromyalgia patient sufferers life a living hell. Because of you, we have to sit in pain 24/7 and can't find a doctor to treat us because you have abused the system. So thanks. In ending, support your friends with fibromyalgia. Support, support, support. It's an ongoing, it's a battle every single day. And we need you. We can't do this alone. I can't do this alone. Love you guys. Thank you if you send this video on, if you help spread awareness, if you support me. Thank you.